Hi, welcome. My name is Dr. Sam Sunshine, and today's webinar is going to be on magnesium. So this is a question that's often asked of me is, do I need magnesium? And if so, which magnesium do you recommend? And so there's a lot of information about magnesium that I don't think the typical layperson is really aware of what's available. So that's what today's talk is going to be on, is magnesium. Hopefully you can hear me okay. And so I'm going to share my screen and we'll get started. So magnesium, a magical mineral. So what are some facts about magnesium? It is a cofactor, meaning it's involved in reactions within the cells of our body for over 300 different reactions that take place. And I heard this many times during lectures, and this is oftentimes quoted in the literature and the articles that are written about it. So that's significant. That means magnesium is needed to convert one substrate to another substrate. And that is, and we'll see as I talk about this, how important it is for us to have adequate magnesium in our body. But it's used for DNA and RNA synthesis, and that is for cell replication. It's used in protein synthesis. So if you're an athlete, certainly that's important. ATP synthesis, that's energy production. And then it regulates muscle contraction, nerve function, our blood pressure, how we metabolize insulin, heart rhythm, nerve transmission, as I mentioned, or nerve function. And this picture on the right talks about, it regulates calcium, also helps to relax the body, and it's used with digestion and so forth. So it's used in a variety of different things. It is an alkaline earth metal. It's this silvery white metallic element. And its alloys are lightweight. Again, we don't necessarily use it for certain things unless we need something to be very lightweight. It can be used in industry, but it is an essential electrolyte for living organisms, for all living organisms. Magnesium is essential. It means our body doesn't make it. We need it from the outside world. We need to ingest it. Or, as I'll mention later too, is we can take Epsom salt baths, which is magnesium. So Epsom salt baths. So some people do that. It seems to help relax their muscles. And it's the absorption of magnesium through the skin. So pretty interesting. And again, we need to consume it regularly to prevent deficiency. And the recommended daily allowance varies depending on your age. And as you get older, it seems like you need more. And male, female, men seem to need more. But oftentimes when I'm attending lectures, that they always harp that women who are menopausal need 400 to 600 milligrams, and men need about 400. And I'll talk a little bit more in detail about that later on. So where is magnesium stored? So again, the elemental symbol for magnesium is Mg. So you'll see in these slides, if I have this word Mg, that is short for magnesium. So where is Mg stored? That's where is magnesium stored? Where does our body keep magnesium? This information varies, but generally it's, 60% is located in our bone and 40% is located in our muscles and non-muscular soft tissues. And it does decline with age, and it's difficult to measure in the blood. So I have a picture of a blood vial. So getting serum magnesium, where it's only like 0.3% is in the serum, 0.3. So that's less than 1%. Some literature says 1%, but it's very small. So it's very difficult to measure. I'll sometimes look at magnesium RBC, and that's looking in the red blood cell. And some people says that gives a little bit more accuracy. And then there are magnesium challenge tests where you can hook somebody up to a tourniquet, start an IV, and give them magnesium and then measure a 24-hour urine. It's super laborious. So that is just not standard of care. Again, I think getting a magnesium serum test is not a good indicator. So it's a challenge. And then this magnesium RBC may be a little bit more helpful, but it still lacks really robust, doesn't give us an accurate reading that's reliable about what's going on in our bones and soft tissue, but it's the best we have. So sometimes I'll check that in people that I'm concerned. So when we look at the intake of magnesium in the United States, shows that it's lower than what's recommended. So 55% of Americans are below the recommended dietary allowance, and that's the RDA, which is oftentimes used to calculate that. And that's rare because we're above the RDA for almost everything. But because most Americans, I think it's 70% Americans really adhere to the standard American diet. And that standard American diet, or the SAD diet, SAD, contains only about 30 to 50% of what is recommended in terms of magnesium intake. So if you're part of the 70% of Americans that follow the standard American diet, which is highly processed, highly refined, really crappy food. This is some stuff that comes in boxes, bags, wrappers. It's the stuff that's within the center of the shopping center. Then you should probably be on magnesium supplementation because you're not going to be getting enough. And we know that over the past 100 years, the magnesium intake has been declining, primarily due to the food processing. Again, the standard American diet, highly processed, highly refined, very low in nutritional value. And the use of fertilizers. So fertilizers that are sprayed on crops diminishes magnesium content of the food. So how much do we need? So this is something that I talked about earlier, but adult men, again, about 420 milligrams a day. So you can round down, like 400 is kind of what we talk about. Adult women, anywhere from 320 to 360. But again, my postmenopausal women who I have on hormone replacement therapy, I'm getting them on 400 to 600 milligrams. And what's interesting is vitamin D does aid in magnesium absorption. So making sure that if you are vitamin D deficient, you're also taking vitamin D. And then this box table on the right kind of breaks things down. You can see when you're younger, you don't need as much. As you get older, you need more. And but I'll talk a little bit too about more isn't necessarily better. Now, when I say that, I'm talking if you plan to take above the recommended dietary allowance, use caution, and I'll explain why. So what are some natural sources of magnesium? This is where we want to start, not taking magnesium pills per se or magnesium supplements, but eating these types of foods. And these are, the chlorophyll and green vegetables such as spinach and kale, nuts and seeds like chia seeds and almonds and cashews. Less rich sources are the fish and meat, fruits and legumes. They have some, but not that much. So again, dark green leafy vegetables, nuts and seeds, again, part of a nutritious diet anyway. Now, if you have an allergy to nuts or seeds or other foods, use caution. I do have a handful of patients who are allergic to avocados, so use caution. Avoid the foods that you react to. Common sense. So what about magnesium imbalances? We rarely see hypermagnesemia. We oftentimes do see conditions of hypomagnesemia, and that's low magnesium. So hypo is low, and low levels of magnesium have been associated with a number of chronic illnesses, such as Alzheimer's disease, insulin resistance and type 2 diabetes, hypertension, cardiovascular disease, stroke, arrhythmias, heart arrhythmias, as well as migraine headaches and attention deficit disorder. So these are things that can be corrected sometimes with things as simple as magnesium supplementation if you're following the standard American diet, which again, most Americans do. But one of the things I've used to treat, with migraine headaches, and I won't get into too much detail about this, but you can always come see me as a patient. I can help guide you. But with magnesium and riboflavin, which is vitamin B2, you can reduce migraine headaches by 54% if you just take those on a daily basis. And we do know that a lot of the supplements we use for blood pressures, magnesium, potassium supplementation lowers blood pressure and to some degree. And what about drugs that lower magnesium? There's quite a bit. And the two common things I see are people on diuretics, and the specific diuretic is really Lasix or furosemide. A lot of people are on that who have kidney problems or congestive heart failure. That can lower magnesium. The next one is a proton pump inhibitor. And there are millions of people who take these medicines, and I think they're harmful. And one reason they're harmful is they deplete magnesium levels. They also deplete zinc, vitamin B12, calcium levels, and there are millions of people take these. An example is Nexium, or pantoprazole, or omeprazole, or Prilosec. There's so many drugs, and millions of people take these for indigestion. And there's so many better ways to treat indigestion with, like, changing your diet, getting off the soda, cutting back on your caffeine intake, using a digestive enzyme, using a probiotic. Those are some of the things, reducing stress, that work way more effectively than these proton pump inhibitors. And you should be taking these long term, but most people do. And then I should have put another arrow underneath the proton pump inhibitors, the thiazide diuretics. And I have a lot of patients who take these, and this is hydrochlorothiazide. So many of you may go, oh yes, I take that. Oftentimes it's attached to another type of antihypertensive or blood pressure lowering medicine like losartan or lisinopril or valsartan, etc. So if you're on those, again, you should be thinking about supplementing with magnesium. So what are some symptoms? And symptoms are things that you feel if your magnesium's low. Now, again, these are not specific for magnesium because there are dozens of things that can cause these symptoms. So just because you have these symptoms, your first thought should not be magnesium deficiency. It's probably, again, poor diet, lack of exercise, poor sleep, and too much stress is what I think about. But poor cognitive processing, headaches, constipation, fatigue, poor sleep quality, muscle spasms, muscle cramping, irregular heartbeat, numbness and tingling, usually the fingers or toes, mood and behavioral disorders. So again, if you have a lot of these things, it could be, magnesium deficiency. So what are some medical conditions that we commonly see that can interfere with magnesium absorption? And that's celiac disease. Most of you may know this. This is sensitivity or reactivity to gluten. Crohn's disease. Again, this is inflammation of usually the end of the small intestine and the colon. And that's where magnesium is primarily absorbed. It is at the end of the small intestine and the first part of the colon. Alcoholism, one, because of poor nutritional deficiency, and alcoholism, again, is pretty common in our society, unfortunately. And so people who do drink daily, you should be on magnesium supplementation or quit that habit. It does age you and increases your risk for all illness and disease. Type 2 diabetes, primarily because people tend to excrete more in the kidneys or in the urine, you have diabetes. And aging, as I mentioned, as we get older, our magnesium requirements increase. So far, so good? Okay, so we're almost done. This is a lot of information. Magnesium is one element, but super important, and it is a question I get asked about a lot. So what about medicines that contain magnesium? These laxatives and antacids commonly have them. The extra strength Rolaids and Maalox. Milk of magnesia, which is pictured here on the right. This is Phillips milk of magnesia. This is a calcium hydroxide, which is in there, and it doesn't get absorbed well, so it stays in the gut, and it helps with people who are constipated. And so it kind of works through an osmotic process where, because it doesn't get absorbed, it stays in the colon, and then our body kind of dumps water into the colon and helps with that constipation. Not something I would recommend as a supplement. Don't be supplementing with milk of magnesia or Rolaids to say, well, this is a great source of magnesium. That's not what I'm talking about. Other forms, as I listed here on the left, is magnesium sulfate. Again, you won't find this over the counter. This is a medication that's used in obstetrics wards for women with eclampsia and preeclampsia. And then you might have magnesium trisilicate, which is used for peptic ulcers. Again, this is not what you would use for supplementation, but it's used for other specific conditions. The magnesium supplementation, this is the questions I always get asked. What magnesium should I take? How much should I take? And this is a tough question to answer. It's not that easy. First of all, not all magnesium supplements are created equal. Again, you have a lot of magnesium capsules over the counter. If you go to any health food store or even any of the boxed pharmacy stores, you'll see quite a few options for magnesium. They probably have their own brand. I always caution people because most of those are magnesium hydroxide, but they are available in a lot of forms. Small studies have been done. No one's really doing a lot of studies on the different forms of magnesium, but there's aspartate, citrate, lactate, and chloride forms. And these seem to be absorbed more completely and more bioavailable, meaning our body can absorb them through the small intestine. It goes into our blood. Then the magnesium oxide and of course magnesium sulfate, which we really don't see in supplement form. The magnesium oxide, which again is probably what 90% of the people that I see that are on magnesium are taking because their doctors recommend it and it's over the counter. It's an inorganic form. The good news is it's high elemental amount, but it's poorly bioavailable. So we don't absorb it, but it's got higher elemental content. And that's what we need, is the elemental content of magnesium. And then you have other ones like mag citrate, mag glycinate, which are more the organic forms. And these have low elemental content, but they are highly bioavailable. So it's the opposite. Some are more soluble than others. Others are more insoluble. You want to find one that's soluble. Some are salt forms. Some other ones are chelated, what they're connected to an amino acid. And some optimize the absorption pathways, others not so well. And so you want to look at the elemental fraction of these as well. So this is, again, if you have questions, come see me. If you're in my membership, please ask me. So I can give you a fundamental understanding of this beyond what I'm presenting here today. Again, some of the benefits of magnesium supplementation: promotes sleep, relieves constipation, calms anxiety, can be used as a migraine prophylaxis, as I mentioned earlier, can relieve muscle cramps, and improves blood pressure. So if you have high blood pressure, not on magnesium, we should talk. Little plug, this is what I use at night. It's called Calm. It's a natural vitality calm, and it's a magnesium carbonate, which is not something I've mentioned, but in 2 tablespoons, you get about 325. 2 tablespoons of this is a lot. I usually do 1 tablespoon in water, cold water, before I go to bed. And I notice that when I do use it, my fatigued muscles are calm. They're calmed down. They're not as tight. I sleep better. I find that I get less restless sleep and more sound sleep. And that's been my experience. I have recommended this to many patients in the past, and some have benefited. Others don't really notice a difference. But it's something you can try. And you can find this, again, it's Calm at like Mother's or Sprouts or Whole Foods. So is too much magnesium a problem? And the answer is yes. You got to be careful. It could be, it can give you serious side effects if you're taking too much, or you're taking the wrong one, right? If you're taking a lot of milk of magnesia, let's say, again, can cause diarrhea, nausea, and vomiting. And it's just true with any of the supplements, any of the magnesium supplements. It can cause fatigue, muscle weakness. So again, GI tract. It can affect your musculoskeletal system, and also your circulatory system. It can lower your blood pressure too much. It can cause respiratory distress and also cardiac arrest and death. So again, not to be taken lightly. Too much of a good thing may not be a good thing for you. So in summary, and again, thank you for listening to this, but magnesium is an essential mineral that you may be lacking because you follow the standard American diet, or you're taking a diuretic, or you're on one of the proton, or you one of, I think, 1 in 10 people who take a proton pump inhibitor, which again, talk to your doctor about that, see if you can get off of that. I don't think it's safe. But diagnosing mild to moderate magnesium deficiency is a challenge for doctors and for patients, because most of the time you're asymptomatic. You don't have these symptoms of weakness and tingling and muscle cramps and headaches. And again, supplementation should be considered, especially if you're doing, if you're on diuretics or proton pump inhibitors, you follow the standard American diet, or you're aging. And that's what is aging? I think aging starts in our 30s, certainly by our 40s. So those are the times where you might consider doing magnesium supplementation, especially if you have high blood pressure or some of the other symptoms that may be helpful. And then again, use caution. I didn't really mention this, but if you have kidney dysfunction, you got to be careful with magnesium supplementation. And then again, avoid overdosing. And what I'm going to try to do now is unshare. Let's see if we can do that. No? Yeah. So again, Dr. Sunshine here. Thank you for listening to this webinar on magnesium. I hope it's helpful. Again, this is going to be directed towards my members. I currently have a membership model, and I practice family and sports medicine in Southern California. And if you live in California, you want a doctor who's progressive and practices functional medicine, sports medicine, come see me. And I'm at OC Sports and Wellness, and our number is 949-460-9111. Other than that, I'm signing off. Thank you for joining me.